Welcome to another episode of the MEDITECH podcast. We're the leader in healthcare technology, empowering you to be a more informed healthcare consumer and provider. Hear the latest from our friends and colleagues on topics we think you should know about. I'm Rachel Wilkes, Director at MEDITECH, and today I'll be your host. I'm joined by Tom Leary, the Senior Vice President and Head of Government Relations for HIMSS, where he leads the organization's digital health policy development. Tom also serves as the Executive Director of the HIMSS Foundation, which is a philanthropic arm of HIMSS. The HIMSS Foundation enriches the public discourse on public policy, advances clinical informatics and data science, and presents undergraduate and graduate level scholarships. This fosters partnerships to advance equity, access, and inclusion in the health information and data management science workforce. Welcome, Tom.
Thank you. Hi, everybody. I'm a public policy person. I'm a patient. I'm a family member who enthusiastically tells parents and relatives and whoever else to use electronic healthcare and believe in it.
So can we start off by talking a bit about HIMSS? Tell me how long you've been with the organization, and can you speak to the mission and goals of HIMSS?
So I think it's important to understand who HIMSS is as an organization and why we get up in the morning. I've been with HIMSS for 22 years, but for about 17 or 18 of those years, I'd blow past the vision and mission and yeah, you can read it on the website or whatever. But our board of directors and CEO realize the full health potential of every human everywhere. We're serious about it. And we leverage all of you as HIMSS members or potential HIMSS members to try and achieve that vision. The mission of reforming the global health ecosystem through the power of information and technology. So it's not just the technology, not just HIMSS, it's actually the actionable information that comes from the data that allows for providers, health system, and individuals to be involved and to improve the outcomes. That's why we get up in the morning.
We work in an inherently dynamic industry, but with the latest federal policy changes and the One Big Beautiful Bill Act, the last few months have really set a new precedent. Can you provide a sort of lay of the land for us? Can you talk about what to expect and what healthcare professionals need to know going forward?
So there's one big beautiful bill that consumed everybody's attention for quite some time and culminated on July 4th. The AI Sandbox Act was just introduced on Tuesday morning, and then Trump administration actions to follow. CMS health tech ecosystem, living HHS open data policy, the AI action plan, and then ASTP/ONC. What we've seen with the Trump administration coming in is a doubling down on the idea that issues like cybersecurity and artificial intelligence and information sharing and cyber certification still very important, still very foundational to the success of healthcare delivery, IT, and all digital health transformation. So the things in healthcare that we need to be concerned about are in some key areas. Medicaid funding, reducing funding, and the Congressional Budget Office is talking about $1 trillion over 10 years in reduction. Some of the other issues they're focusing on within the legislation is telehealth and digital access. We have until September 30th to continue the expansion of telehealth services as they were identified during the pandemic. So if you remember, on March the 13th, they declared the public emergency. So on March the 12th and prior, the majority of the country did not have access to telehealth services. Pandemic, thanks to a lot of conversations that HIMSS and others had had with the government, the secretary was given the authority to expand telehealth services to allow for access to care while not exposing people to the emergency rooms and not overrunning the emergency rooms, et cetera. Those telehealth services have continued beyond the pandemic, and Congress has extended them year over year. The most recent is through the One Big Beautiful Act. So I think what's important for all of you to understand from a policy perspective is that CMS has figured out every which way they can to make sure that remote patient monitoring and some telehealth services are covered under Medicare. There is a requirement for legislative relief. That legislative relief means Congress needs to act. They've acted through September 30th, and there's some indication that they'll extend again through December. So the action that I would suggest that you take is making sure that your member of Congress and senators understand the importance of and the transformative way that telehealth has been incorporated into healthcare delivery across the country. Because if we don't extend, Medicare is required to go back to March the 12th, 2020, where telehealth services are only covered Hawaii, Alaska, and some very remote areas of the country. It really comes down to who is eligible not only for Medicaid, but for care delivery overall. And then finally, establishing the $50 billion Rural Health Transformation Fund, requiring states to submit improvement plans by December of this year. Those are all key components that impact healthcare that has got a lot of people scared and scrambling.
You touched on this a bit already, but one thing that's been a major concern for health systems and patients alike has been the looming cuts to Medicaid. What do listeners need to be aware of with these cuts looming? What is HIMSS anticipating?
Last week at a meeting that I was at, there were several health system individuals as well as some current and former government folks that are saying we're correcting the overreach on Medicaid that occurred as part of the pandemic, and we'll agree that during the pandemic it was important to not have people without health care as they were losing their jobs. But the amount of time that we kept people on the rolls has really overstressed the system. So there's this market correction. To me, that's really the underlying discussion that we've got happening in this country since the election is the idea of, are we heading down a path that $1 trillion in cuts to Medicaid over 10 years is going to be completely devastating, or the path of better efficiencies can actually make the programs better, make for better outcomes. So from a policy perspective, HIMSS is anticipating, and it's got to be somewhere in the middle, right? Because we can't go back prior to Obamacare. So if we're trying to find a balance, it's going to require all of us working together on what are the technology efficiencies, what are the other things that can be leveraged to help care continue to be available, as well as making sure that some of the efficiencies are starting to be put in place.
At MEDITECH, our customers range from large multi-entity health systems to rural and critical access hospitals. What should rural healthcare leaders know about the $50 billion in funding that's been allocated by the Rural Health Transformation Program?
As far as the Rural Health Program is concerned, the announcement by CMS on Tuesday was that there's going to be a process for an application at the state level to be able to be eligible for any of the $50 billion. So I strongly encourage folks to get involved, reaching out to your state officials, reaching out to your governors, and understanding how your state is going to be putting together their proposal for the submission. But right now, every state is scrambling, trying to figure out how are we going to approach it? What's our submission going to look like? So if you're in a health system, whether it's connecting with MEDITECH, connecting with HIMSS, connecting with your state hospital, whatever your avenue into advocacy and policy makers at the state level, making sure that your voice is heard. It's $1 billion, but it's only $1 billion, right? $1 billion is a lot of money until you start trying to divide it into a whole state plan. From a policy and engagement perspective, making sure that you're engaged, whether you're the CEO or you're taking it back to your CEO and your government relations person, is connecting into the state to understand how your individual state is going to be applying for those funds.
Can you share your perspective on how AI is being used across healthcare today and how policies at the federal, state, and even international levels are evolving to keep pace? What key trends or implications should healthcare leaders be aware of as they navigate this really rapidly changing landscape?
So you've got the tech community that's full speed ahead on use of AI, and you've got other parts of the community that's, hey, we need to implement AI, and we all know the benefits of AI, but there are certain things that we're still unsure of. And so what states are starting to do is, in the absence of a national strategy around artificial intelligence, what states have been doing is looking out on the horizon and seeing that the European Union had passed the AI Act for 26 countries that are part of the EU, and they're seeing what impact that has for multinational corporations that will end up building towards the EU's requirements. And they're saying, wait a minute, we learned the lesson of privacy. If you go to any website in the United States now, you get the whole message around cookies that you have to click on, yes, I understand, etc. That's a direct result of the European Union's GDPR, privacy laws that were put in place around 2015. And because the United States didn't take action on a national approach to privacy, the de facto law was compliant with GDPR. So what states are seeing is there's this opportunity. Again, we don't have a national strategy around AI. So the states are starting to say, this is the framework that I believe should be developed. So state legislation is popping up in different places. If you're a technology company, MEDITECH and others, you have to comply with the 50 different approaches of the 50 states plus the jurisdictions. What Senator Cruz is suggesting is a pause on state action until we get federal action. And I think what all of us need to understand is that's great if there's federal action. But if there's not federal action, then we have this de facto from other parts of the world. So we're going to be paying very close attention to that.
As interoperability standards evolve, how do you see CMS's recent policies aligning with, or maybe diverging from, the earlier frameworks like the 21st Century Cures Act? Are these new efforts building continuity or creating additional layers to navigate for providers and vendors? And really, what does this mean for patients and their access to their own data?
What's important for all of you is that all of these ideas around interoperability and making sure that the patient has access to their data and the clinicians have access to the data and actionable information as quickly as possible, there's concern that we're not going fast enough. So CMS has used the power of their size, their ability to impact payments and all the different things that CMS impacts. And they're saying, we want to move forward on making sure that patients have access to their data. And they're doubling down on the idea of leveraging the technology community to make sure that we find faster ways to get information to the patient and faster ways of making sure that the correct information gets to providers. So no longer concerned necessarily about the certification process that has been put in place since meaningful use. No longer necessarily concerned with all of the structure that's been put in place over the last decade, trying to figure out ways to get health systems to buy into being more innovative and technology companies to be more innovative. So it's critical for us to understand that they're using the power of CMS for those activities and having a interoperability pledge and a new program for information sharing. There's confusion in the marketplace right now whether or not the qualified health information networks that are run through the Office of the National Coordinator and through the Sequoia project that was put in place as a result of the 21st Century Cures Act, whether or not this new CMS structure is leveraging that structure or are they creating a competing system. For the first 4 months of the Trump administration, CMS seemed to be only doing things that they wanted to do, only engaging in the health tech ecosystem, pushing for this information as fast to the patient as possible and not thinking about the structure that was put in place. What they've more recently talked about is leveraging the certification program that ASTP-ONC has been responsible for since the beginning of meaningful use way back in 2010, 2011. What's key there is the information blocking requirements. In the 21st Century Cures Act, Congress required the Office of the Inspector General and ONC to define what is not information blocking and what the exemptions were. If I'm ready to information share, but the receiver is not ready to gather the information, if they don't meet the security requirements that I've put in place or that are standard across the industry, I can not accept information coming in, or I can not send information out. And there were a total of 8 different exemptions that were put in place to try and address some of the concerns around who am I sending it to. So point being now is that the certification program, they're looking at modifying that to focus on APIs instead of EHRs and other certified electronic health products. So changing the scope of ONC's approach, but also 21st Century Cures Act, if you're an information blocker and you don't meet those 8 exemptions, it's $1 million per instance that's identified by the Office of the Inspector General. So what happened last week was the Secretary team and ASTP and OIG said, we've had this enforcement capability, we're now leaning into it. So we need to be paying very close attention to what that all means. And if there's modification in the 8 that shrinks down to 5 or whatever, it's going to be something that's very important for all of us to be paying close attention to.
We appreciate you walking us through the ever-changing healthcare landscape and touching on important policies like the One Big Beautiful Bill Act, as well as the funding via the Rural Health Transformation Program, and onto the future of telehealth and AI. Thank you for joining us today, Tom, and sharing your valuable insights.
I appreciate it. Thank you.
Thanks for tuning in. Stay informed and subscribe to the MEDITECH podcast, and we'll talk to you next time.